If you study health and social care, you'll be studying the Cambridge Technicals Extended Certificate Level 3. This would be worth 1 A level if you study it as a single, or we offer 2 A levels, which would be the double award. Why you should take this course. So you should take this course because it will make you employable. So this year has really taught us how important our health and social care system is and how much we rely on it. And this will really take you to the heart of it. It also teaches you the fundamental skills of any health or support worker, teaching you the rights that you should be maintaining and the values of care. And it also gives you the privilege to make a difference to other people's lives. It also helps you to develop knowledge of your own and to develop your own critical opinions. This may change some of the opinions that you had before and will help you become a good professional. So our specific entry requirements are that for standard sixth form entry, but also it's preferred if you have a GCSE grade 5 in a related subject, health and social care, or a merit at health and social care, but neither of these are essential. A good grasp of biology would be useful, particularly when we get to anatomy and physiology in year 13, and good level of writing skills is essential. In our single award, we have 6 units, 3 of which are going to be an exam, 3 of which will be coursework. Our first unit, Building Positive Relationships, is all about how we use communication skills to build positive relationships with others. This can be down to normal communication, such as verbal and non-verbal, but it can also go into specialist communication, such as using Braille and sign language. Inequality and diversity, we look at discrimination and how we can maintain the rights of individuals and how we can deal when these rights are broken. In health, safety and security, which is another exam, we look at how we can maintain infection control policies within health, social and childcare sectors and legislation that can be used to support people to make sure that injuries don't happen in the workplace and to make sure that people are protected when they do. In anatomy and physiology, you learn about a variety of different health conditions and how to reduce the risk of these and to how to support and monitor the conditions, as well as how to treat them. In your nutrition coursework, you'll look at a range of different nutrient deficiencies and the effects these can have on the individual and how we can make adaptations to the diet to overcome these deficiencies. In your mental health coursework, which is Unit 17, you'll look at what it means to have mental health, what it means when someone develops a mental health problem, the signs and symptoms of these, and the support we can put in place for these individuals. In your double award, which is worth 2 A levels, you have an exam unit on Unit 6, which is personalised care. This is about how we make sure that person-centred care is always available and how we put this into place and the benefits of it. Unit 7 is all about safeguarding. This is another exam, and this looks at the risks of abuse, the signs of abuse, and who is more likely to be abused, and how you can deal with abuse when it starts to happen. In Unit 12, we promote positive behaviours. So this would be the support we put in place maybe for people with specific learning needs and how we can help them to promote their positive behaviour through the strategies that we use. In Unit 14, we look at the impact of long-term physiological conditions, so things like chronic illness such as heart disease, what can be the long-term impact of that if left untreated, and what support can we put in place to make sure it doesn't get to that point. In Unit 5, Infection Control, we look at how we can reduce the risks of infection in health, social and childcare settings and what to do if there is an outbreak of infection. In Unit 22, Psychology for Health and Social Care, that's when you'll learn about the different areas of psychology and you'll start applying these to health and social care environments, and that can be used to then improve adherence to medical programmes. You'd want to study this at TOBOA because we have a highly experienced, skilled and supportive department. We've got a range of resources and reading materials that you can use to support your learning through the use of journal articles, magazines and NHS resources. We offer plenty of opportunities in health and social care to give students practical insight, and we advise you to get work experience. Where would you go after taking this course? If you were to go straight into employment after taking this course, you'd be looking at roles including support workers or healthcare assistants or working with people with special educational needs. If you decided to continue your studies, whether that be through university or a higher level apprenticeship, you could be looking at areas such as nursing, midwifery, becoming a paramedic, mental health nursing, occupational therapy and teaching, as well as a range of others. We have good feedback from our students. So here we have one from an aspiring paramedic that was really happy with how the course was delivered to her and the amount of support she was given. Thank you for listening.